Welcome, all you dear viewers of Dr. BMS channel, to today's video where we discuss medical therapies used in rehabilitation. This is a continuation of the series of discussions we've been having about what really goes on inside a rehabilitation center so that you viewers can know that when you bring your loved ones into rehabilitation, the following things are going to be done and you can support the treatment effectively. So today we talk about medical therapies in rehabilitation, like I said. But before we go into details of medical therapies, I would like to start by saying that in addiction rehabilitation therapy, overally, there are two types of therapies that go on concomitantly, hand in hand. We have the medical therapy, which I will talk about today in detail, and psychotherapy. So, psychotherapy, just to inform those who may not be knowing, psychotherapy in simple terms would translate to treatment of the mind. Psycho is the mind, therapy is treatment. And this is because, as I have said in the previous video, addiction is a disease that affects the body, the mind, and the soul. And so when we are treating, we treat the body, we also treat the mind, and we treat the soul. For the body, we treat using medical therapies. These are tablets, injections, things that you find in the normal hospital when you go with malaria or typhoid, and the doctor prescribes and the nurse gives you some injection. Those are medical therapies. They are mainly used to treat the body. For the mind, we use psychotherapy. And a good example, a common example of psychotherapy that people know out there is counseling. And we also treat the soul using aspects of psychotherapy as well and spiritual therapy, which I will discuss in later videos. So today, let's concentrate on medical therapy as part of addiction rehabilitation therapy. Medical therapy is at 4 levels. I call them levels because we move from one to the next, not necessarily in this order, but we move from one group of therapy under the medical to the next, and we move back and forth sometimes until we achieve the objective. So these 4 levels are detoxification therapy, concomitant illness therapy, opioid replacement therapy, and relapse prevention therapy. So detoxification therapy, people have heard about this a lot and we get lots of questions about this. Detoxification therapy, I did a previous video to explain. You can check on Dr. BMS channel. Detoxification therapy mainly is about cleansing the body from the toxins that accumulate in the body when you get addicted to drugs of addiction, alcohol, cigarettes, miraa, marijuana, all those things. You accumulate toxins in the body, which we need to remove as we start your rehabilitation. And when we are doing detoxification therapy, there are two main objectives. We want to prevent withdrawal symptoms from developing and treat any overdose, because some of the patients brought may already be overdosed, and we need to reverse that. Withdrawal symptoms are these symptoms that come because you have missed your drug of addiction, which you take on such a regular basis that if you miss, you exhibit symptoms. These symptoms can be like someone being irritable, unable to sleep, they are nauseated, they are vomiting, they have diarrhea, sometimes they have tremors, sometimes they have body aches, the body muscles are cramping, and sometimes even they have convulsions, like someone who is epileptic. Those are signs of withdrawal. And overdose, because you've taken too much, you may come in a state of a stupor. You are not able to breathe well. Your skin is very cold. Your temperature is dropping. Your eyes are pinpointed so that you're not able to see well. And those are signs of overdose, which we also treat during the initial stage of rehabilitation called detoxification therapy. Also, in detoxification therapy, we treat malnutrition, which is a common manifestation of addiction because addicts usually do not eat well. And so they suffer a global malnutrition, and we replace lost nutrients and items of nutrition so that we treat malnutrition and rejuvenate the body. Then the concomitant illness therapy, the next level. Here, concomitant illnesses are those illnesses that come together with addiction, because addiction is an illness. And so people coming into rehabilitation will have addiction, and some of them also have other illnesses. The common examples, many have mental illnesses, psychosis, schizophrenia, depression, anxiety. Some of them have liver disease. You've heard of liver cirrhosis in alcoholism, for example, peptic ulcers, hypertension, diabetes. They can come with all sorts of diseases, just like someone else who is not addicted. And when they're in rehabilitation, we diagnose these illnesses and we treat them so that the therapy, the rehabilitation is wholesome and we are not leaving anything out of the treatment. The next level is the opioid replacement therapy. You probably have heard of methadone clinics. They have started being available here in Kenya, especially at the coast and in Nairobi. And opioid replacement therapy means that someone who is addicted, usually to the hard drugs, heroin, codeine, morphine, all those hard drugs, usually when they come into rehabilitation, we grade them down by giving them a drug which is not as potent as the one they are abusing. And we hope that over time, we will wean them off slowly until they can stay without using drugs. So it is like someone who is climbing down a stair. We take you from the high level stair to the next level until you reach the ground floor. This is what is called opioid replacement therapy. The commonest used is methadone, but we have others that can be used as well. And then the last level is relapse prevention therapy. And in relapse prevention therapy, usually at the end of rehabilitation period, this is a time we feel we have succeeded fairly well in our rehabilitation. And now we are preparing to let this person go out and live a life outside the rehabilitation center. So we want to prevent relapse. Relapse is when someone goes back to their old ways of abusing drugs. And we want to prevent that. We use medical therapies. One of the commonest medical therapies that I used is the Naltrexone, and many of my patients come asking if you have this Naltrexone or this implant which you can give someone and they stop taking alcohol, abusing marijuana. The answer is yes, we have relapse prevention therapy like Naltrexone. We also have nicotine replacement therapy for those who are smoking tobacco. And methadone, as I've said, when we are talking about opioid replacement, also prevents relapse of people who are using the hard drugs. Now, this relapse prevention therapy of note is that they can only work if someone has gone through rehabilitation fully and they have converted their mind to have a desire to stop abusing drugs. And so these drugs of prevention, relapse prevention, then act as aids. They help you along, they strengthen your willpower so that you do not fall into the temptation of relapsing to drug abuse again. And so they cannot be used to replace rehabilitation. You cannot come into a rehabilitation center and the first day we give you an implant of naltrexone or nicotine replacement patch and you say you are okay, because we have only given you something that's working on your body. but your mind is still set in the addictive ways. Your spirit is still set in the addictive ways. Remember, I said addiction is a disease of the body, mind, and soul. And so we need to work on your body, we need to work on your mind, and on your soul. And when we have done that, we can let you go out with the relapse prevention therapy like naltrexone implant. Thank you very much for listening to me, and I hope this, in a nutshell, helps to explain why we use medical therapies and which medical therapies we use. And so when you're bringing your loved one into rehabilitation, then you can understand better when we say we will go through the rehabilitation period, and at the end of it, we will give you the implant that you desire your loved one to have.